All right, everyone, we are going to go ahead and get started. Thank you so much to everybody for being on the call today. I know we have some people that are still working to get on with our Zoom technology, so we will likely have more people jumping in and getting started soon. So it is so good to be able to have time with all of you in the midst of busy schedules. My name is Amy Escott, and I am the project director of the Missouri Academy of Child Trauma Studies. And I will let him introduce himself, but joining us today is my colleague, Dr. Matt Kleethermes. Matt?
I gotta unmute myself. Yeah, my name is Matt Kleethermes. I'm the training director at Children's Advocacy Services of Greater St. Louis. Really glad you were all able to join. We look forward to having a nice conversation about a difficult topic.
Yes, and we are also very excited that our executive director, Dr. Jerry Dunn, is joining us by phone. So we're very glad that she was able to join in. Jerry, do you want to say anything? I know you're having some technology issues.
Yes, sorry. No, thanks for letting me remote in. I just want to say a big thank you to our community. As always, we have come together to support kids and their caregivers in a very difficult time. And many, many thanks to Amy and Matt who came up with this idea and have put it together very, very quickly. So be sure to let us know if there's any additional topics that as a community we need to learn about, and we'll do our best to put those together for you. Thanks so much.
Great, thank you, Jerry. And we also wanted to give a huge shout out to our training and logistics coordinator, Stephanie Lane, who helped put together all the communications and slides and is helping us run the technology today. So as we are getting started, we do ask that you can go ahead and keep yourself on mute. We were so grateful for the questions ahead of time, so we will do our best to address those over the course of our time together today. And any questions that we can't address, we will help pass along to others in our region and in our state and try to pass that information back on to everyone as needed. But please do feel free to use the chat feature if you have questions sort of as we go along. So we wanted to start ourselves today with this quote from Maya Angelou, which says that having courage does not mean that we are unafraid. And we just wanted to acknowledge that our discussion today is about supporting children and youth in this time of profound uncertainty for our community. And it is normal and it's appropriate for all of us to be feeling uncertainty or anxiety or fear, but that doesn't prevent us from being courageous and really working together to do right by children. And so we wanted to start from that place because we do think it's our shared responsibility, which I think is evidenced by having over 250 people sign up for this meeting today with half a week's notice in the midst of lots of upheaval and lots of changing schedules. So with that in mind, our goals today are really to talk through strategies about how is it that we can explain all of this coronavirus, the changes in routines to children in ways that will help promote resilience with children. We want to talk through specific strategies of some quick and easy things that caring adults can do to help children feel more reassured. And then we also are going to spend a few minutes talking about what are concrete next steps when a grown-up has concerns about a child's physical health or sort of their mental health response to coronavirus and everything happening in our community. We also wanted to sort of give a shout out that we had a number of fantastic questions from our mental health providers that are jumping in on the call. We wanted to be really clear up front that some of the questions regarding telehealth and ethical issues regarding continuing treatment are things that are really beyond the scope of this webinar today. However, we have gone ahead and passed those questions on to our colleagues at the Department of Mental Health, and we will try to sort of intersperse words of wisdom as we go along. But Matt and I also wanted to emphasize that this is all unfolding, and so kind of what information and best practices we have are all really still emerging. So with that, let's talk about coronavirus. So as we have been inundated with by the news, we thought it would be nice to sort of say, this is what we're talking about today. So as hopefully you all know, coronavirus is a respiratory disease that is mainly passed person to person. It is novel, meaning that we have not previously identified it in humans, and it is something that currently there is not a vaccine for, as we are hearing updates on day in and day out. People are working on vaccines, but at this point, there is not a specific vaccine for coronavirus yet. The best preventative strategy, which we'll come back to later, and you can see as Matt's background on his screensaver, is prevention. And so the Centers for Disease Control has fantastic information about the medical side of things, and we'll be talking through some of that a little bit later in regard to what instructions can we give our children and our teens to help them understand what it is that they can do to help keep themselves safe. The good news as far as children and teens go is that thus far, data that we've seen from other countries shows that children are much less at risk for coronavirus than other age groups. The children that we do need to be concerned about are those who have pre-existing conditions. So children that might be vulnerable to respiratory or heart problems, the CDC is recommending that those families go ahead and check in with their medical teams. One of the biggest strategies that you have probably heard lots about, and that our university is talking about a lot as well, is the idea that the best way to prevent the spread of coronavirus is social distancing, to try to reduce the speed at which the virus spreads. And so that can include lots of things. So in Missouri, we've seen that in many schools, of schools closing and workplaces transitioning, where the goal is to try to keep people separate so that the germs are not passed on to each other. And you may have also heard the term quarantine, which that is officially the separation and restriction of people who have been exposed to the virus. And we really, again, will just keep encouraging you to go to the Centers for Disease Control website if you want more information about those pieces. The CDC also has some great handouts from medical providers that could be used by mental health professionals to have up around your practice, and just gives good guidance about how to manage and prevent the spread of coronavirus. The other piece that we wanted to sort of throw out here is that when the virus first was being discussed in the news media, there was lots of analogies to this being another type of flu. So we wanted to be very direct today that the CDC is saying, stop comparing this to the flu. It is very different, and we want to make sure that we're not adding confusion to children and teens by saying it's just like the flu. Because with the flu, there's a flu shot, so it can be tricky as to, well, if it is like the flu, why don't we have the vaccine and all of those pieces? Anything you want to add at this point, Matt?
No, I think you've covered it really well. No, nothing at this point.
Okay. So a big question that our center has gotten a lot is, what do we say to kids about coronavirus? So we've had families that have said, we're just telling the kids it's a long spring break, or I don't want kids to worry that they're going to die, or they're not going to understand what's going on, all of those pieces. So our number one piece of advice is that you should go ahead and talk to children and teens, even our really little children, about what is going on with coronavirus. And the reasons for that are multifaceted. So one, children learn from grown-ups, and we want to make sure that children are being given the most accurate information that we have, recognizing that we don't have all the answers. Right? So some families are saying, I want to wait till I have all the information, but we might never have all the information. So it's important to go ahead and pass along what accurate information we have, and acknowledge to children the things that we know and the things that we don't know. A big reason for this is that we want to clarify misinformation. And so children are talking about this a lot at schools. They are overhearing lots of different things. We had one child who said coronavirus is a type of car crash, right? Because their friends were playing it at school. So they were like playing coronavirus. This was from a preschooler, right? So clearly it's not a car crash. And so we need to make sure that children have accurate information. It's also important because I kind of made this point already, but many kids have already heard bits and pieces or heard the TV or radio being on if they're out and about in the community. So they've probably heard some of the media coverage without having all the information that they need from the grown-ups that love them and take care of them. So to that end, actually talking to kids about coronavirus in developmentally appropriate ways will help reassure children of that they are safe and that the grown-ups around them are caring for them and taking care of their health needs. So what we're going to go ahead and do now is take a minute and talk about how is it that we could actually talk to children about coronavirus. So we're going to sort of walk through an example that you might be able to modify for preschoolers, elementary age children, and then talk through some caveats for older children. So what we've included here is a script that you can feel free to use in whatever way is helpful. So if in thinking about maybe a second grader, we first want to make sure that kids know what germs are, because some kids know different amounts of information about that. So for a younger child, you might go ahead and say something like, okay, so as you might know, germs are things that you can't see that hop from person to person. Sometimes these germs can make us sick. Right now, you may have heard about coronavirus, which is like a cold with extra big germs that are really sticky, which means that lots of people can get sick at the same time. Children usually don't get big sick from a coronavirus, but children can help keep everyone healthy by being extra careful and washing their hands and by spending more time at home until these extra big germs go away. Okay, so what you'll notice in that paragraph there is it includes, like, these are some concrete things that children can do themselves to sort of help protect themselves and help others. And it also includes language of children usually don't get big sick, because we want to make sure in talking to kids that we are not over-promising. And that was a question that came up ahead of time of saying, if I'm working with a child or a teen that's worried that they're going to die, how do we respond to that? Because I can't make this absolute promise. And that question is spot on correct, right? So what we can say is that usually coronavirus is something that we do not know of is a frequent cause of death for children. And so using words like usually helps to find that balance. And then the next piece here on this slide includes information about reassuring kids that really whose role it is to sort of manage their health. So it's helpful to sort of conclude with something like, what? There's a lot going on and a lot of things might be different than usual, but your job is to play and learn and have fun. And you can ask me any questions that you have about coronavirus, right? So we really want to be direct with children, that we want them to come to trusted adults for information about coronavirus. For children of all ages, we don't want them reading things online or overhearing conversations. Well, they will overhear conversations, right? But we want to make sure they know that it is okay to talk to grown-ups about coronavirus. So as you're thinking through that, for our older children, we want to make sure that they do have information that's really targeted to their age. So the recommendation from the National Child Traumatic Stress Network would say that for our older children, it's perfectly okay to sort of follow their lead. So letting them know what is the status of the outbreak, how is it contracted. This kind of goes into questions we got about what to do with teenagers that really don't want to listen to social distancing recommendations or don't think it's going to happen to them. And we agree, the struggle is real. So, finding that balance of letting them know what are the things that are going to increase the risk. And just as we would for our younger children, we want to make sure we're emphasizing, like, this is what your community and country and globally is happening in order to protect you. And we also want to make sure that they are clear about, like, these are the ways that you can help. So for example, teenagers can help with cleaning within the home. They can help with other responsibilities so that they feel like there's things that they are contributing. Matt?
Yeah, I just wanted to add, I I think a lot of kids, some of the bigger questions they're going to have are why has so many things changed in their day-to-day life? Like, why am I not going to school? Why can't I go to birthday parties? Why can't we go out to dinner on Saturday night like we usually do? And so I actually heard a really nice analogy for that that I think might be very helpful in communicating this to kids. And they compared the steps that are sort of being taken in the community and in the state, nation, whatever right now, as being similar to like if you're at a swimming pool and there's a bunch of people in the swimming pool swimming, which is what you do in swimming pools. But then if there are people who are starting to struggle while they're swimming, if there's a bunch of people in the pool, that makes it really hard for the lifeguards to know who needs the most help. And that really what we're doing right now as a community is trying to get all the people that maybe aren't in that much danger out of the pool so we can make sure that we're identifying the people that really do need the help, that really are, struggling. And I thought that was a really nice way to kind of explain why we're making such a big response, even though a lot of people may not be at that much risk.
Wonderful, thank you. So another option for our older children, this is a social comic strip. We've included the link here. I think we should have said this earlier, but we will be pushing out PDFs of these slides. But this is sort of a social comic strip that one might use with older children, right? It's intended to be engaging and kind of funny. I really enjoyed, for those of you that are joining us and can see our screen, the piece of the comic strip where it says avoid touching your face, and it says don't pick your nose, don't touch your mouth, don't rub your eyes. And then we have a character being like, but I love to pick my nose, right? So it's trying to use humor to sort of lighten this while still making sure that accurate information is being passed along. So in having all of these conversations with kids, the biggest piece of advice that we would have is that as the grown-ups, we need to manage our own anxiety and our own worries that are super appropriate and make sure that we're having these at times where we as the grown-ups feel as centered and put together as we can, right? So sort of like that airplane analogy, where if you're on an airplane, they will say, put on your own oxygen mask prior to putting on the oxygen mask of a child. We want to do that for ourselves as well. The other piece that is sort of a very natural instinct is that when we talk to children and teens, we often just want to explain everything and give kids as much information as possible. In fact, that can actually be overwhelming. So the other piece of advice that we have is to give only as much information as the child needs in order to feel secure. And with children and teens, what we often see is it's sort of kind of like a one-time question and you answer it. And then a couple days later, they might pop up with a follow-up question. So we want to really encourage that this is a series of conversations and that it is not like a one and done sort of thing, in part because the information about what's happening in our world is changing. And we would then want to update children kind of as it goes along. So we want to caution you against that over-explaining. And then just remember that for especially like our preschool age children, to just go ahead and do check-ins and comprehension checks with them to make sure they understand. So that might look something like, so honey, we talked about coronavirus. Now, do you remember what that means? Or, I know our school is closed. Do you remember when we talked about why it is that school might be closed for a little while? We just want to make sure that they are comprehending and understanding, which will provide security for them. We hit this point a little bit earlier. Our goal is also, right, as caring adults, we just want to reassure kids that nothing bad is going to happen to them ever. And unfortunately, we can't do that. And so we want to recommend as well avoiding promises. So avoiding making that statement of don't worry, you're never going to get it. And also making sure that we're not over promising that nobody we know will ever get it. So instead of promising, it's often helpful to think about how can I provide reassurance. So, even if someone in our family might get sick from coronavirus, we have really wonderful doctors and hospitals that will take care of them and do everything they can to help them feel better. And then we hit this point earlier, but just as a reminder, children can often take responsibility for things that they are not responsible for. That is part of normal development. And so looking for any opportunities to just remind children that your job is to play and have fun, and thinking about coronavirus and making sure that they're safe is something that's really a grown-up's responsibility. So Matt, anything that you would want to add at this point?
No, I think we're good to move on.
All right. So now we're going to go ahead. I'm going to turn it over to Matt, who's going to be walking us through what are some concrete strategies that we can use to help support children.
Okay. So thanks. The first thing we wanted to do is just talk a little bit about stress, because obviously this is a stressor that the size of which we as a country we haven't faced since possibly like September 11th or something like that. But when we're faced by those stressors, I think sometimes we can lose sight of just how kids in particular are impacted by stressors. And this one, I think, is actually a slide that is helpful maybe to pass on to adults who are caring for children, to let them know that actually most kids bounce back from stressors, even something of this nature. If you look at this, 70% of kids basically just heal on their own. Like they'll bounce back from this event, the pandemic, without much difficulty. 20% may need a little extra support, and really that's what we're going to be talking about throughout the rest of this talk. And then it's really only about 10% that maybe require more intensive treatment services. So I think it's really helpful particularly for anxious caregivers to keep in mind that roughly 90% of kids are going to bounce back from this with relatively little difficulty or support. So just to kind of cover some groundwork, when we think about what a stressor is, really stress is anything that impacts us and makes us have to adjust. So a stressor is something we have to pay attention to. We maybe need to have to change our behavior in response to it. And subsequently, since it's not our normal way of doing business or our normal way of functioning, it increases demands on our energy. And so I would guarantee that everyone on this call can recognize that what's happening with the coronavirus definitely would qualify as a stressor at this point, given how much attention it's requiring, how much it's changing our day-to-day functioning, just the inability to buy some of those basic things we need from the store now subsequently is just all putting extra demands on us. Okay. So what we know from sort of a stress load standpoint is that there is a sort of a simple balancing act that we as humans are doing, where we have to balance the load of the stress on us with our capacity to tolerate stress. And so really this kind of exemplifies our relationship with stress, that as long as our capacity to tolerate stress is larger than the load, we're usually able to do fine. But if that stress load is getting to the point where it exceeds capacity, that's where people's functioning starts to take a hit. So that really brings this idea of coping to the forefront. And coping is really something that all of us need to be thinking about quite a bit, both adults and children. Given what's going on right now, we have a lot of things that we need to cope with. And really, coping, you can define it as it's the way we change the two basic things that we do on a day-to-day basis. We need to change the way we think, and we need to change the way we behave. And by doing that, by changing that, those our ways of thinking, our behavior, that's how we can potentially increase our capacity to tolerate stress. And that makes it easier for us to cope with, everything that's going on. And, I imagine right now, many of you are probably aware of ways where people may actually be changing their thinking or behavior in ways that might not increase their capacity to cope, but actually may be increasing their stress. if people are fixated on, the horrible things that might happen if they were to develop coronavirus or if a loved one were to develop it, that's not going to help them manage their, that stress level. It's going to make it harder. So obviously we're going to want coping to try to, be going in directions that would increase that capacity. All right, so again, we go back to this idea that when we're coping, we need to make adjustments to reduce the impact, to try to alleviate that, that load on us. And so there's lots and lots of ways that this can be done. It can be simple things like using deep breathing to relax when we're feeling tense. It may be coming up with some sort of problem-solving strategies to make working from home easier. It may be developing, structure or activities for kids to follow when they're at home for the next couple weeks instead of dealing with their normal routine of schoolwork. And we're going to talk a lot more about specific things we can do to help come up with these adjustments moving forward. So when we talk about helping children cope, children cope in a lot of the same ways that adults do. Helping children practice relaxation skills, particularly for more anxious or worried kids, or kids who have more of like a physiological response, like if they're having headaches, stomach aches, sleep difficulties, increased fidgeting, or just hyperactivity. These types of relaxation skills to help calm the body can be really useful. Practicing cognitive skills, so just helping them think in more helpful or healthy ways. So it can be thoughts like, I'm not sure when I will go back to school, but I can still learn at home. And maybe I'm not sure when I'm going to get to see my friends face to face again, but social media can allow me to still stay in touch with them despite the quarantine. And this kind of leads into that next bullet point of maintaining connections to social contacts is really important. Humans are definitely social creatures, and we get comfort from being in contact with friends and loved ones. So being able to maintain those sorts of relationships, even if it looks a little different than it did prior to being dealing with quarantine or things like that, can be really, really valuable. And that last bullet point, I don't think we can stress this enough. Just kids, even though they often push back against structure and rules and things like that, we all know that in truth, they really, really thrive on structure and routine. And structure and routine, lead us to having a sense of control, having a sense of things being predictable. And those are probably the two biggest variables that help us increase a sense of capacity for dealing with stress. The more control and routine we have, the more comfortable we tend to feel.
And that, I'm just going to jump in there too.
Please do.
I like to say to people as well of sort of like, what message would we be giving our children and teenagers if a 17-year-old kid came home after curfew having been drinking and had no consequence because coronavirus is happening, right? Like, or if a younger child, only wanted to eat ice cream instead of having to eat a full meal before having the dessert, if all of a sudden we just start giving desserts everywhere and not having consequences, we are inadvertently reinforcing messages to children that that the world is profoundly different than everything that they know. So we'd like to avoid doing that, even though it can be tempting to just be like, yes, just have the ice cream.
All right. And something I wanted to add just on that, on the flip side, I think it's also important, particularly for parents, to recognize that their parenting stress level is going to be going up over the next couple of weeks just due to 24 hours, 7 days a week contact with the kids. So it may still be important to think about what are the battles that aren't worth fighting. Amy's right that we need to enforce kind of like the critical rules and structure, but maybe there is some places where flexibility makes sense to help the caregivers kind of keep their sanity as well. Mm-hmm. All right. Now, want to talk a little bit more about just alleviating, that impact or that stress load, and just talk briefly about what we know about resiliency. And these are just, some variables out there that have been shown to be associated with kids who bounce back from stressors relatively well. And what I think is interesting about all of these, given the situation that we're dealing with right now, is potentially we're sort of limiting access to these resiliency factors as well. Because if you think about family support, maybe they're not able to see their extended family, grandparents, things like that. Peer support, they're not necessarily able to see their friends. Competence, maybe they're a really good athlete, but now they're not able to participate in their, like sports teams or things like that. School connectedness, well, now, they're not able to be at school in the same way. Spiritual belief, a lot of churches are closing down services at this point. So I think given that a lot of the natural ways we access these resiliency factors are sort of limited right now, I think it's really going to be important to help families and children think creatively about how they can still access these. So can they still FaceTime with grandma and grandpa to get that familial support? Can they practice their sport in the backyard with mom or dad, so they can still feel like they're developing those skills? Can they, my daughter's school is doing a really nice job of helping kids stay in contact with each other via technology. So are there ways that we can still allow for this to help kids access that resiliency? Next one. And so when we look at resiliency, we can also kind of break this down into sort of four large sort of categories. And so these are things like individual characteristics. So this is helpful when we think about, not that we can necessarily develop these on the fly right now for kids, but this may be a helpful way to recognize kids who may be more or less resilient. So if we know kids who just have a temperament where they're prone to lots of anxiety, or they're prone to lots of self-blame, we may want to keep an extra eye out on these kids, those types of kids for the time being, because they may need that additional support that we're talking about. But other things maybe we can do a little bit more, be more proactive about. So family cohesion. Over the next 2 weeks, it might be really important for families to try to do things that are really focused on bonding as a unit, playing games together, having movie nights together. That will help build resiliency. Community characteristics, again, we're kind of cutting off access to those somewhat, but thinking about how kids can still stay in contact with peers or mentors. And then this last one, cultural protective factors. Again, we're talking about things like spirituality. If spirituality is really important for a family, making sure that they're building that into their family routine for the next couple weeks. Finding ways to continue to access cultural identity, practicing talents and skills. These are all ways that we aren't maybe going to be able to actively do these now the way we typically do. So thinking outside the box could be really important. Okay. So now shifting from talking about stress and wanting to focus a little bit more on actual concrete strategies. We've touched on these to some degree, but I think the biggest one is this first one, is that really making sure that since schedules are up in the air right now for kids, school, that predictable school schedule isn't there for the next maybe couple weeks or so, to make sure that we're finding a way to establish that type of schedule within our family setting. So making sure we're keeping bedtimes routines stable, meals, still exercising, still finding time to do some schoolwork. It can also, as a family or as a caregiver in particular, reflecting on what has helped your family overcome stressors in the past. So if you've had a loss in the family, what have you done to help cope with that? Was it maybe engaging in family prayer? Then family prayer may make a lot of sense now. Was it doing something like, telling each other, funny stories? Then let's do that now. And then having children participate in distant learning opportunities that may be offered by their schools. There's also a lot of apps that are just freely available that can help with keeping kids on task with schoolwork as well. So I think encouraging caregivers to keep their kids on board, because that's just going to help create that sense of normalcy. these are examples, and I think nice visual examples that parents might want to create just to help develop sort of a visual representation of a schedule for the upcoming weeks. I like this next one, or the first one, you need to check all these boxes before screen time. So read, write, create, move, think. And then they give nice examples of what that might look like, that they could practice before, getting on YouTube or whatever it may be. The right-hand side is another daily schedule, just another example of what that could look like. And Amy, I think you might have had a little more information about these.
Yeah, so these were developed by one of our colleagues who's a pediatrician. And one of the things that we liked about the daily schedule is we just want to acknowledge that all of this and having children at home, particularly the school part, is profoundly overwhelming for grown-ups. And so there's all sorts of things floating around online. And we just wanted to emphasize that if you're a parent on this call, to figure out what is going to be the best fit for you and your child and your family. So one of the things I liked about this daily schedule is, I don't know if you've noticed, but it doesn't include times, right? So it's like breakfast, art, movement, snack, reading, writing, math, lunch. So it sort of allows the child to sort of do the same things, but no one has to feel the pressure of, we must have breakfast by exactly this time.
Mm-hmm.
So we just wanted to emphasize thinking through what's the right fit for both the grown-up's personality as well as the child and the family structure.
And that's a great example, I think, of that middle ground of having structure while still allowing some flexibility.
Mm-hmm.
Yeah. Okay. So continuing with some more concrete strategies for grown-ups, I think a big thing here is just accepting and recognizing that people are going to have some uncomfortable emotions during the next couple weeks. There's going to be some loneliness, some feeling like isolated, being bored, some anxiety about getting sick. So all of these are just kind of normal reactions. So we don't necessarily want to worry about kids just because they're anxious or bored. Those are relatively normal. And that also doesn't mean we should just let kids sit in those feelings. So I think it's important to think about ways we can engage our families in fun, meaningful activities with family culture, within family and cultural values. So normalizing, it's okay to feel this way, but we can also engage in some behaviors to help alleviate that. So just some practical things that I think it's important to keep in mind is, make sure you have your number, your important phone numbers handy. Have the pediatrician's number ready and available, and call it if you have some anxiety or worries about your child's health. Maybe look into the process for contacting the county health department to know sort of what's out there, maybe regarding testing or things like that. Also having a good social contact plan. So think in advance of how are you going to help children stay connected to family and friends. Don't just say, yeah, we're going to do it. Have some specific plans for how that's going to look, when it's going to happen, what time frames you're going to use, what kind of activities might those involve. So being proactive and having a plan, because that's going to increase that sense of predictability and control that is so important to alleviating stress. This, I think, is an important one. This, I think, is almost a callback to things we talked about following things like 9/11, but making sure that the information that you and your family are accessing is both accurate and that you're also getting it in digestible bites. So thinking about how are you getting accurate information? I really hope people by now know that social media is not a great place to get this kind of information, because there's so much misinformation that's being thrown out there, or things that are being passed on as accurate, but nobody's doing fact checking. So I think really knowing what are the sources of good information, like the Center for Disease, CDC, think that your county health department. So really thinking through where can we get honest, good information. And this issue between balance between too much and too little. I've heard of, friends and colleagues I know that are finding themselves getting almost like addicted to coronavirus updates, and like they're constantly following it and counting how many numbers of cases are in their state. And I think really keeping in mind that that sort of inundation of this is really not helpful. And we really need, particularly for kids, to kind of limit that direct exposure to coverage. Having CNN or Fox News on 24/7 during this is probably not going to create a sense of safety for our kids, because there's a lot of sensationalizing that goes on there. And just everyone needs a break from this. And, along with making sure that, we're not allowing kids access to anxiety provoking things through the media, I think it's also important that we monitor what we're doing. Because keeping in mind that children look to adults to figure out, like, what happened? How should I react to this? How should I cope? What's the best way? And the best way to take care of kids is to take care of ourselves. So is my parent still eating well? Is my parent still exercising? Are they still taking time to watch TV and have fun? So I think, really helping caregivers think about what message might their behavior be sending to their kid. So is the caregiver panicking about, making sure that everyone they know isn't sick? Are their caregivers going out and buying pallets of toilet paper? Because all of that's going to increase that idea that this is something to be anxious about.
Right. Thanks, Matt. So now we're going to go ahead and transition from sort of what we can do to sort of help stabilize children and youth right now to how might we know in really concrete ways when we might need either some medical or some mental health support for our families. So as far as medical support, this information comes from ESSA Health, a pediatric practice here in St. Louis. What we liked about it was very specific. And I think with all the information going on right now, that like the specificity when possible to communicate with parents is helpful, just like specificity is helpful for children. So according to ESSA Health and the Centers for Disease Control, we would become concerned about children. Again, children don't get coronavirus as often from what we know so far, is going to be if we have a fever of 100.4 or higher, if there's a cough, or if there's trouble breathing. Okay, so most likely if children do get this, they can be treated at home and they will recover. The biggest risk actually with children is that they could inadvertently spread coronavirus to older adults or others in the population who could become more vulnerable. So if you are worried about this, to Matt's point earlier, the first step is to go ahead and contact your pediatrician's office as well as your health department. And we include those numbers here in the next slide. The biggest piece of advice that pediatricians have given us in preparing for this is do not just show up at a doctor's office or an urgent care center or an ER unannounced. For a couple reasons. We want to ensure that our medical system has capacity to help those that are most in need. We also want to make sure, on the off chance that a child might have coronavirus, that the medical team is ready and knows how to triage them appropriately. So it's both about not inundating our medical system as well as making sure that if we do need those services, that we are appropriately protecting everybody around us. So with that, they also encourage you, if you do need to call an ambulance or you do need to call any sort of emergency support, to let them know at the time that you might be concerned regarding possible coronavirus. Okay, so the next step slide here, for those of you who are on by phone, these are just some helpful phone numbers. So for our broader St. Louis region, we've included St. Louis City, St. Louis County, Jefferson County, St. Charles County, County Health Department numbers, as well as there is a Missouri State Department 24-hour COVID-19 hotline. So that number is there for you. And we've also included the link to the St. Clair County Health Department, since we know we have some Illinois people on our call today. All right. right. So hopefully that's a little bit helpful. Again, we will also just say that the American or the APA for pediatrics, as well as the CDC, both have fantastic sets of information as well. So Matt is going to walk us through a little bit about what we might see in children as far as stress responses based on different ages.
Yeah, and I'm not going to spend too much time on the next few slides just because it's never fun just to listen to somebody read things. But I think it could be helpful to think about a couple different issues. So, with young children, thinking about what changes in behavior, play behaviors might look like. So if we're talking about like distressing themes, so a lot of times with like trauma or stress exposure, we might think about themes of violence or something like that. But I think if you're seeing things like themes of illness or like going to the hospital, or if their play is just kind of chaotic and dysregulated, those might be things that we need to keep a lookout for. As far as developmental regression, just sort of our typical regressive behaviors like separation difficulties, sleep problems, toileting. I think a real barometer for a lot of young children are tantrums. And I think a nice way to think about tantrums in young children is it can be sort of a way that anxiety can be presented. So just helping caregivers kind of have a rough idea that increases in these sorts of behaviors may be prevalent in response as kids respond to the coronavirus situation. But I think, and also another idea that we may want to help parents think about is they're going to be with their children a lot more than they had been prior to this, just if they're all now at home 24/7. So some of this, we want to make sure that they're not necessarily exaggerating normal developmental behaviors just because they're seeing them more. So young kids, 2 or 3 year olds do have tantrums. So just trying to differentiate between developmentally appropriate versus inappropriate may be really important. So for school-age children, similarly, all school-age children, occasionally have some difficulties with concentrating or paying attention. So we really want to keep in mind what is normative behavior. But other signs that parents should be looking out for are, increased irritability or aggression. Maybe they're isolating themselves more often. We may see increased startle response or increased anxiety, in this case around like hypervigilance around cleanliness or germs or things like that. And just similarly, just worrying about family. Are they going to get sick? Are grandma and grandpa going to get sick? Is my baby brother going to get sick? So that increased anxiety. Sleep problems similar to young kids, we may see that as well. And what's interesting for school age kids is we may see concerns about increased shame or guilt for things that are not their fault. So maybe they start worrying about somebody getting sick because they forgot to wash their hands 3 weeks ago, and that maybe caused this person to get sick. So if they're hearing that kind of self-blame, that could be something that we need to help address and look out for and correct. Then with teens, a lot of us, I think, are fairly familiar with teens maybe routinely engaging in maladaptive coping strategies or isolating themselves from family. But we're really talking about them moving away from things that teens typically would do. So, playing too many video games may be a normal maladaptive coping strategy, but, increased alcohol consumption may be something that we would need to be concerned about, or like an increase or, starting to engage in self-injury. Similarly, isolating themselves socially, it's normal for kids to kind of separate themselves from grown-ups when they're teens, but if they're separating themselves from peers, particularly, they have to do that sort of physically now, but if they're cutting off social media contact, things like that. We might also hear some really concerning thoughts in terms of like doom or gloom, concerns about the future, like everything's going to be horrible, this is just going to keep happening. and just pushing away support in general. Next one. Oh, sorry. And then really, I think most importantly is when to think about when do kids need mental health support. And so a lot of those reactions, like we touched on, may be relatively normal in small amounts or in moderation. But if we're seeing reactions that are interfering with home behaviors, so like they're no longer able to do bath time without a gigantic fit, if they're not engaging in self-care, like taking medications when they're supposed to, like we mentioned already, if they're talking about or committing acts of self-harm, if we're seeing difficulty sleeping that is getting to impact, it's impacting their functioning. So having, it taking 5 minutes longer to fall asleep is one thing, but if they're only getting, 2 or 3 hours of sleep a night because of nightmares or things like that, then we're going to be seeing functional impairment. Similarly, if they're having frequent physical problems, so, we're not talking about they actually have the flu or they're having coronavirus symptoms, but they're actually having frequent physical symptoms that don't have a medical cause, like stomach aches or headaches or things of that nature. All of these would be times to suggest that that stress load that we talked about earlier is overwhelming their capacity to cope. On a similar note, if they're routinely talking or asking to talk about their experience of the coronavirus, if they're seeking support, that tells us they probably do need it, especially if we're seeing them talk over and over again about some sort of specific instance or experience, and it's like they're kind of stuck. I sometimes think of it as like the verbal vomit, where it just keeps coming up over and over and over again. That really kind of tells us that there's something that's they're struggling to move past it, and it's hitting their capacity to cope. And then finally, if they're experiencing or expressing feelings of helplessness, hopelessness, just like we would think about with typical issues with depression, we should take that seriously at this time, and it may be more than just a normative stress response. This slide just talks about some basic psychological first aid core actions that can help stabilize mental health responses when we're dealing with stressors. So I'm not going to read through all of these because we've kind of touched on a lot of them already. But this was developed to really help cope with stressors of this nature. So it's really focused on things like contact and engagement, safety and comfort. So this is an evidence-based practice that's been designed to alleviate the kinds of symptoms we've been talking about. So I'd encourage maybe even looking to this a little bit more. And there's information, there's an app for this that can be accessible, that may be a helpful way to integrate this into what we're doing. And then as far as securing mental health support during the COVID-19 outbreak, I think we need to keep in mind that mental health providers are working with regional leaders to increase capacity for telehealth. So a lot of the mental health providers I am having contact with are already taking steps to stay in contact with their clients via telehealth. But I do think we need to keep in mind that these options are still emerging. There's still some uncertainty with regards to how this works, with regard to our standard mental health functioning. So I think we're getting this up and off the ground, but it may not be running as smoothly as we would like right off the bat. And I think it's also helpful to keep in mind there's really some great online resources to help with kind of like basic coping skills. So things like Cosmic Kids Yoga, PBS has some great resources out there. Coping Cat Parents. All of these are things that can help parents coach their kids through some like mental health concerns or issues. And definitely I would encourage everyone to let families know that they should contact their mental health providers or resources or just professionals that they haven't had contact with for online resources if a face-to-face meeting is not possible.
All right. Well, thank you. Hopefully the information that we have discussed today has been helpful. I know Stephanie has passed along one question that came in. So the question was, what are some suggestions for helping young children stay connected, particularly for young children who do not like FaceTiming? Or should we assume social connection is not as important for children this young? So thank you for the question. It's a fantastic one. So the first response is one that those social connections are just as important for our toddlers and preschoolers as they are for our teenagers. So we do want to think creatively about what are safe ways to maintain some of those connections. So some other options, if it's a child that really doesn't like FaceTime, it might be something where it's drawing a picture for a teacher or a family member that the parent then takes a picture of the drawing and sends it to the person. I've heard from lots of families about starting like some pen pal and sending things through the mail. I'm unclear about like the safety of worries about germ transmission through the mail, but I thought that was an interesting idea. I also read an article with yesterday being St. Patrick's Day about a community where people put shamrocks up in their houses, and then kids could go sort of like on walks with family members to try to find as many shamrocks as they could. So sort of using social media as parents to set up some sort of activities that kids could safely do. Now, an activity like that obviously would depend on sort of the overall level of community violence. And so that for many people in St. Louis, something like that wouldn't be an option. So also thinking about reaching out to teachers or babysitters or daycare teachers to ask about what might be some songs or videos or books that the child really enjoys at school that you could then bring back to the house and bring in that way. And then another daycare I heard of sent pictures of the teachers home with children when they were closing. So then the child has kind of a picture of like, these are all my buddies from class that they can look at and talk about. So just ways of working to kind of concretize who some of these people are so they can stay front of mind for children, even if they may not be able to see them every day. Okay. So another question that we had gotten ahead of time, I think we already addressed a little bit, but sort of how to talk to children if they are worried that they are going to die, and sort of that balance between how much information to give versus not give, and what do we promise versus not promise. So again, that would just be kind of going back to that script that we discussed and being able to say to a child, we really, really hope that that you don't get coronavirus. And very few children that get it get kind of like really big sick. And so from what science is telling us for right now, this is not something that we need to immediately be worried about. Okay. Stephanie, are there any other questions that have come in so far? And we can also open it up for people to verbally ask questions too. We have a few minutes left.
Oh, can you guys?
We can see you, yes.
Yeah.
All right. Sorry, I've been getting up and I gotta go to work as a health tech at a substance abuse clinic. Hi, Matt. I think you remember me last semester.
Yeah.
Yeah. This is interesting because they've put us on quarantine for except for the staff. Don't ask me why, but whatever. They put us on quarantine for at least 2 weeks, and I've got a minor cold, but nothing serious. Yet yesterday they had a small fight, and the director took away all their movies, and he took away their privileges to go outside now. And I'm wondering, okay, what do we do now for the next 2 weeks? Because we haven't removed the social contact, but we've just taken away the outlets for creativity, for fun. And I'm wondering just how long before it turns into Lord of the Flies in there. we've got that type of issue. What do we do here?
A quick question I have, is that sort of like a normal response? Would that have been the normal punishment for that
For
infraction?
maybe for an hour or two, but that he's the way he's talking about it. The director's talking. He might make it the full 2 weeks, and I'm thinking that's not good.
Well, I mean, I think that's really problematic because not only does that, does it eliminate all the stuff we were just kind of talking about, like that
Right.
kids need, but it also, what are you going to do if they have a fight tomorrow?
Exactly.
Because now
And
you've really got no other options as far as consequences go. Um, so, I mean, I don't know. This is kind of a tough position, so I don't know if there is a like subtle way that you can pass on some information about how that's not maybe that's not going to mirror what we know kids need during this time.
right.
But I feel like that might be the best option.
All right. Well,
And
I've got a good relationship with my boss, so he likes the straight shooting, straight
Okay.
from the hip guy. So I'll just tell him, listen, this is what we got to do
yeah.
Yeah.
So I
because
also just want to jump in. That question sort of is a nice lead into other resources. So on the slide,
yeah.
we have resources. There's one from the Child Mind Institute about talking to children about coronavirus, as well as if you just Google nctsn.org for the National Child Traumatic Stress Network, they have a fantastic handout that's a PDF that we referenced is in preparing for today. So it might also be nice to have some concrete materials that one could just pass along to somebody else in order to help advocate in order to do right by children.
Okay, that sounds good. And these are teenagers, by the way. So
Yeah.
Yeah.
it's that extra roadblock, and it's a co-ed facility. So we've got that as well.
Yeah.
And
Yep.
Yep.
So then another question that has come up a number of times, which we really appreciate because we feel like it really reflects how fantastic our broader community and region is in wanting to do right by children. So we know that a lot of people are very, very worried about children being home and not at school because for many children, school is the only place that is safe. So we've included here some resources. So the United Way has a link to coronavirus resources, Operation Food Search. Many public school systems have some sort of food access program that they are running. So it might be where the children come up to school and they're sort of like handed a lunch. I don't know the ins and outs of all of those details, but we wanted to make sure everyone was aware of that, as well as there are some restaurants listed here that, including like the Crazy Bowls and Wraps in both Ferguson and Florissant, that are offering free kids meals while school is closed in an effort to help with that. I think a lot of that information, I know we said to limit social media, but if you need a break from it, but a lot of that information does seem to be being passed around via social media. We also, our team yesterday spent some time talking about childcare resources for families where all of a sudden they are out of childcare. And we have not been able to find yet any sort of consolidated list or recommendation. It appears that families are sort of figuring it out ad hoc. An additional question that came in ahead of time before this webinar was surrounding the issue of how old do children have to be before they stay home alone. And the answer to that, per our understanding, is that Children's Division has not set an age of the child needs to be this age in order to safely stay home alone. So if you're working with a family where they're trying to make that decision, it's helpful to consider what is the child's developmental level, what is their knowledge of how to handle an emergency. So if someone were to come to a door, what would they do? If a fire alarm went off, what would they do? Are they going to be caring for other children? Do they know how to properly use the stove and other things within the house? And most importantly, if they needed something, is there a phone or a way that they can contact their grown-up? So those can be some factors that I think could be helpful in determining if a child is or isn't old enough to sort of be home on their own. So we really wanted to finish by thanking all of you for your interest in this. We want to emphasize that this is clearly the start of this conversation. So please keep us posted sort of as questions keep coming up, because we will work with our partners at the regional, state, and national level to try to help continue supporting all of the grown-ups in our community that are working so relentlessly to be flexible and meet the needs of our children and families.
And Amy, I just wanted to throw out real quick too. Last we heard, I think this was yesterday as well, St. Louis Crisis Nursery is keeping 3 of their 5 locations open.
Mhm.
So although that's not going to meet just general childcare needs, I think if there was specific concerns or threats for the kids and the stability of the family, that would still be an option.
And sort of adding on that, I know a number of people ask questions about supporting families where people are undocumented or non-English speaking. So we did get confirmation that Crisis Nursery does not collect information about legal status as part of their services. And the handouts and resources that we've included all include Spanish versions so that they could be passed out to Spanish-speaking families. Great. Well, thank you all so much for being here today. We appreciate your time and support. And we hope that everyone is able to stay safe and kind of continue supporting children. Thank you.
Wash those hands.
Wash those hands. Bye.
Bye.